before working with you, she was taking a leave, several a day sometimes. She was on Prilosec for her heartburn, and then she was on birth control to control her cycles. But everything has normalized, and it's amazing to watch. Really, really amazing.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Darshaw, who holds a PhD in integrative medicine, a doctorate in OT, specializing in neurology, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices of her homeland with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast Series Lyme Disease, Dr. Jodie A. Darshaw.
Today we shall talk about herbal medicine as a viable alternative, especially for chronic illness. Often when chronic illness strikes a child, the family suffers. Parents go from pillar to post and knock on many doors to find answers to help relieve their child's suffering. Many of you may be familiar with my personal journey. And today we are very fortunate to have with us Holly and Dr. Stan, who have very kindly and generously agreed to talk about their experiences with chronic illness and herbal medicine. Welcome you both, and thank you so very much for being here.
Thank you so much.
Thanks for having us.
So let's jump right in. Holly, can you tell me what originally brought you to BioNexus Health and choose plant-based medicine? And do you think you made the right decision? And Stan, please feel free to jump right in as well.
Sure. It's our pleasure to share our story. It's been quite a journey, but Lydia was born in 2004 with lots of love and prayer, and she's had just a hard childhood of being chronically ill. She would be the kid that picks up all the stuff out there, Coxsackie, all the viruses, and lots of fevers, and just different things with her health over the years, but she would always bounce back. And it wasn't until the year 2018, we went to Arizona to meet with family for the holidays, and she came back from swimming and abruptly said, "I just feel really, really ill. I don't feel good, Mom. My body hurts." And sure enough, she had a fever. We took her to urgent care. They said, "It's probably a virus." Lo and behold, it was not the Christmas present she wanted, a viral infection. We come back to New Jersey, and she's still just having a very hard time recovering. A lot of fatigue, on and off fevers. We bring her to the pediatrician, and the doctor says, she just needs lots of rest, and she'll be back to good health in no time. And we waited. A couple days turned into a couple weeks, and sure enough, her energy never did return. She was a competitive swimmer and had to actually give that up. Our pediatrician did give her some antibiotics because she thought she had a sinus infection on top of all this. And it was amazing how azithromycin actually made her feel better. Again, after the course of the antibiotics, she did not attain the good health that we had hoped for, which made us go investigating onto why. Why is she not able to have the energy she had before, and why is she cycling through not feeling well? And so our pediatrician said, maybe we should test her for Lyme. And I was quite impressed because I had heard other people say, maybe she has Lyme. We had heard it from, I think, one of your fellow doctor friend's wife, and just a lot of people at church. Have you tested her for Lyme? So it was interesting that the pediatrician went ahead and tested her. And sure enough, the results look like she may have has something with Lyme. So we won't get into all the controversial approaches of how to assess the testing.
But even by CDC, she was positive. 2 out of 3 bends positive on the Western blot, which is, as everybody knows, not a very sensitive test.
Right.
But And then she also underwent more specific testing, and that came back positive as well.
And so, again, getting her well became this very draining and overwhelming process because we really didn't know what we were in for. And so friends had recommended find a Lyme literate doctor. I felt so blessed because I had a lady tell me from church about the Lyme group on Facebook for New Jersey folks. And so I joined the group, and so many wonderful people really wanting to help and sharing their experiences. But I went to all the comments that would give me hope, all the patients that found something that would help them. That's what I really needed, because I know that, chronic illness could take a route where it's devastating, but I was determined to find those places where the stories of hope existed. And, we found several recommendations, and our first stop was with a more conventional approach where she took, several different antibiotics, but for Lydia's body, it was just not the right fit for optimal wellness. We knew that there was something more that her body needed, because I think it's much more than attack a bug. I think it was, at this stage in the game, it was a multifaceted approach that we needed, because it wasn't just fatigue. There were lots of parts of her systems that were not functioning well, from migraines all the way from the head, ocular issues, light sensitivity, noise sensitivity, to POTS-like symptoms where she would feel like she's going to pass out if she got up too abruptly. Everything from, the heart fluttering too much.
Peripheral neuropathy too.
Yeah.
Burning in the fingers. But mostly I think it fell under 3 categories. One is the migraines. And the second one is she felt seasick a lot, like nausea, wanting to throw up, those kinds of things. And then the last thing was the overwhelming fatigue. So, and those 3 things just kind of cycled. And once one thing relented, the next thing came up. And so she was in a bad cycle for many, many months. We brought her to, what?
Oh.
What? Testing?
Yeah.
What? What? No, there's some part of the story. No. So we wanted to almost prove that there was these symptoms. So we brought it to NYU in Columbia. NYU was an expensive visit, and it just showed basically that she does have peripheral neuropathy. We actually took biopsy samples of it, and she was equivocal for POTS, right?
Yes, and then, I think she had terrible gut issues, even since she was very young. She had, a lot of loose stool, just very sensitive gut. And so, again, this was like a multifaceted issue. It wasn't just that she got sick, because she was sickly growing up. So for us, we had found your name because there was a lady who posted about how her daughter was so sick but now was in college, and that's what I needed to hear, that there's always hope, and there is a future for Lydia. And so I looked you up and tried to get on a list. I think there were several months of waiting, and
It was a long wait list.
It was a long wait list. But we put our name on, and I remember the one afternoon where she was just so ill in bed. She really couldn't do very much, and she had these flu-like symptoms, and she was crying, and I was crying, and I said, "Oh, I wish you can have the help that you need now." And that afternoon, while I was resting with her in bed, your office called and said, "We have a cancellation. Do you want to come in?" I think it was for the following week. And I just felt so gracious, so grateful, and so overwhelmed that spot opened. So I really felt like that was the path we were supposed to take. I think, we couldn't always agree on treatment because we just didn't know what we were dealing with all the time. but we always agreed on a more natural approach for Lydia.
There was always the offer to go into, even IV antibiotics, but we always felt that that wasn't the best for her. A lot of it was because of her gut. Her gut was always never good, so we didn't want to stress it even more.
And so when we met you and you looked at the lab work and you just said, oh, that makes sense. And you were able to pull like the bigger picture together. And it was a really big aha moment for me. But Lydia already knew. It was funny because she knew after that appointment, she said, this is it, I'm going to get better. So it was meant to be that we would venture into the avenue of more natural and specifically herbal regimen for her. And her body thrives on it. It does just so, it's a perfect fit for her. And so, mentally she was prepared even before meeting you. She just said, this is it. And so she knew. And so we were so grateful because along the way, we've had many people who wanted to help us. And we're so grateful because she did get to a certain level of wellness, but it wasn't really until we started your approach of really attacking all the body, systems, where she's able to do so much today. I mean, 2 years ago, she missed a lot of school and she couldn't be up for many, many hours, but now she's back in high school and joining musical and doing so many after school activities, and it's just amazing. She doesn't swim full time yet, but she's ventured into singing, and so we're just so grateful. So yes, for us, plant-based medicine was the answer for Lydia's health and wellness.
Yeah, before she needed 10, 12 hours of sleep a day, minimal. So during her sophomore year, she never got into school before 10 o'clock, 10:30. Mm-hmm. Now she sleeps a normal amount. Sometimes she sleeps too little. She's a night owl, so she wants to stay up till midnight. We have to kind of, keep her in check. Like, you still need rest. You always have to remember, in the past, you don't want to relapse. So you want to make sure rest is half the battle. So
she's taken a whole new approach, right? Eating healthy, reducing your stress. These are all things that work perfectly with the herbs, right? All these wonderful things to accommodate her body. So good thoughts, being grateful, so for us, we really feel like, yes, BioNexus approach was really the right fit.
Mm-hmm. So Stan, you're an MD, and it's absolutely amazing, that you have been able to support Holly and Lydia through this process, and I have to applaud that. From your perspective, as both of you mentioned, biotoxin illness, Lyme disease, co-infections, these are, as you observed, multi-system illnesses. So what systems did you see come back online using only herbal medicine? Her system, if you would like to emphasize on symptoms, that's fine as well. You mentioned neuropathy.
Yes,
perhaps,
right? System, yeah, that's gone away. So the peripheral nervous system has gotten better. Central nervous system, she doesn't get many migraines anymore. It used to be every other day. She get migraines at her sickest. Now it's maybe once a month. In fact, that might be with her cycle. Anyways, we both get migraines as well. So it can just be a baseline hereditary thing. Right. But the autonomic system is big. She used to, as it attaches to the gut, she used to always have this reflux really bad through her entire life, actually.
Yes.
It's not just, so we talked about December of 2018 and on. Even before then, she would always have gut issues and a lot of reflux. In fact, I've brought her to many of my friends in the past. And she got scoped by an ENT doctor who said, oh, she's definitely got reflux pharyngitis. And that's gone away. Yeah.
Yeah.
So she
That's
doesn't
gone
complain
away.
about that. Yes. So a lot of these, she had, along the lines of autonomic system, she had palpitations, and she doesn't really complain about that anymore as well. So, this is totally out of my purview, but because as a radiologist, I just look at anatomy. I don't look at function. So this is very foreign to me. I was just trying to solve it from, sometimes an anatomic point of view, or taking it to some of my friends, infectious disease and whatnot, and try to have them, even like pediatric gastroenterologist.
Right.
I had her scoped actually. It seems extreme, but this is what, as a doctor, as an MD, as allopathic medicine, this is what we can do. So if she's got this reflux, if she's got belly pain, just stick a scope down there and take a look. And of course it was negative. So it's something that, is not just simply anatomic.
Right.
So that's why, thank you for, your approach, something that I don't understand. But it seems to have worked.
Yeah, it does. And especially her endocrine system, like she was on the pill before, all moving over to natural treatment. But, she is off of, a lot of medications. I think before working with you, she was taking a leave, several a day sometimes. She was on Prilosec for her heartburn, and then she was on birth control to control her cycles. But everything has normalized, and it's amazing to watch. Really, really amazing.
That's exactly what has been wonderful to watch for me as well. I remember meeting the two of you, mother and daughter, for the first time, and Lydia was trying really hard to be stoic and strong, and you were in tears, and I remember my own journey, wishing to take away your child's pain, to do whatever needs to be done, and she's your only child, just like Brian is my only child. And now it's been a while, since we do regular follow-ups, and I speak with you and I see you smiling and relieved, and she's back in school, she's able to study, she's able to keep those typical teenage hours and some typical teenage activities as well. So that must be that just must be so life-changing almost for all of you. And it's been, I'm so grateful to be able to watch this metamorphosis of this beautiful little girl. She's phenomenal with her diet. She sticks to her diet. She takes the herbs with no complaint. She knows, intuitively what resonates with her. Am I right?
Yes, yes. She will say if even a natural supplement, if it's not the right one, she'll let us know. It's amazing. Her body, like you said, she's very in tune with her body.
Right.
So no complaints. She's great at it.
She's very compliant. Talk about the non-compliant patient. She's not non-compliant.
So would you say she's also lost her POTS, more or less, or it's gone?
Oh, yes, yeah.
Yeah.
Okay.
Yeah, she doesn't have any more orthostasis anymore.
Okay.
Yeah.
So once again, thank you for being here today and sharing your story. I know it will help many understand the benefits of considering a plant-based medicine approach, because looking at a complete clinical scenario and being able to address that only with the plant-based medicine may seem a little alien to many.
Oh, I'm sure. Sure.
It was to me. We didn't study any of that in med school. It's an approach that I wasn't planning on taking. In fact, we have many, many bottles of unused antibiotics upstairs that I was more than willing to jump in and go with the traditional route. But, you know, Lydia's gotten just increasingly better month by month since she's been with you. So I really didn't want to mess anything up. And I know that for long term, plant-based treatments are more sustainable because even the allopathic societies agree that being on long-term antibiotics is not a good idea. So I'm just I'm surprised, but you know, I can't argue with the results. So to see Lydia how she was before to how she is now is 180 degrees. So thank you.
Yeah, and you know, healing really is a journey, and I think oftentimes in this world we want immediate results and immediate healing. And what this has really taught us from before and after is we should embrace every part of the journey, every ups and downs. Yes, when I was in your office, I was definitely at the bottom of the pit. But now that we've gone through this, we've seen that it's worth the journey. Lydia always says, Mom, it's part of my story. So, you know, when she's feeling a little under the weather, you know, I'm quick to say, oh no, are we reverting back? But she reminds me gently and encourages my spirit, Mom, this is part of my story. And so the encouragement is be patient with the herbs. You know, natural isn't immediate all the time. And especially someone like Lydia who had years and a history of symptoms and unwellness, we had to let the medicine do its wonderful, miraculous work, and we had to be willing to be patient. And so look for the healers out there and look for hope. There's always hope in every situation. And I think, you know, plant-based medicine for us really gave us a lot of hope, and we're living and basking in that hope today. And so we just want to encourage people out there, don't be leery, don't be afraid. Give it a try and be patient with it. And yeah, and you know, see what the results can be, like you said, transformative, you know, like a metamorphosis. And so we're thrilled. So thank you, Dr. Deshore. We know it takes a lot of work on your part too, to listen and to assess. And it was a journey even for us. You had to, you know, figure out, pull back some things, add some things, let's get more blood work. So, you know, it's like a dance together, right? And so we have to be willing to be, you know, patient with each other too, right? And not to have this expectation that, you know, you just like have a magic wand and everything gets better. So again, wonderful dance, a wonderful journey, and now I would say I wouldn't trade it for anything. So thank you very much.
Thank you so much again for you know, joining me today. I'm sure there's many people listening, and it's going to spark a lot of hope in many hearts, especially under the current global circumstances. So
yeah, a positive attitude is always a good thing. Yes. And a lot of prayer too.
Yeah, it's a big part of our journey was prayer, praying about everything, prayed about even all the herbs, and for you and for Brian, your son, and you know, and look at that, like now you're a part of our life and we're a part of your life. And again, it's just so beautiful how this all intertwines, right? That you are a big chapter in Lydia's story, and so is plant medicine. So very, very blessed.
It's been a huge privilege helping Lydia get well and get to this place of healing where she is not just surviving, she is thriving today. Well, for everybody listening, thank you for joining us today. And I'll be back with other guests in the near future as well. So thank you for joining us today.
Thank you for joining Master Herbalist Dr. Jody A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.